Greetings everyone! In this session we will be recapping the basic oxygen delivery devices for work in the frontline. My name is Dennis Lee and I will be taking you through this session. By the end of the session you will be able to recognize the following devices: the nasal prong, Venturi face mask, standard oxygen face mask, and the non-rebreather mask, as well as the O2 CPAP mask. You will also learn about the strengths and weaknesses of each device. Most importantly, we will cover the escalation strategy for using these devices. Let's start with the clinical situation. LV is a 30-year-old man who's been admitted to the ED with pneumonia. In the last week, he developed a cough and sore throat which did not improve. Fortunately, a COVID screen was negative. However, 2 days ago he developed fevers, a productive cough, and chest pain. This morning he has been feeling very unwell and is finding it difficult to breathe. He arrives at your ED obviously anxious and breathless. His SpO2 measures 85% in room air. What oxygen delivery device is best used for this clinical situation? Our options are nasal prongs, the standard oxygen mask, the Venturi face mask, the non-rebreather mask, and the O2 CPAP mask. Now, the escalation strategy we should be applying when using these devices is as follows. This escalation strategy is a useful way to structure an approach to selecting an oxygen delivery device in the clinical situation. It is based upon the increasing oxygen concentration that each device is capable of delivering. The nasal prongs have the lowest capacity of oxygen concentration at around 40%. Since they only generate such low levels of oxygen concentration, they are indicated for only mild hypoxia. It is a very simple device that increases FiO2 simply by increasing oxygen flow rates. It is usually well tolerated by patients. However, it cannot be used at flow rates greater than 6 liters per minute for prolonged periods, as this increases the risk of drying the mucosal layers of the nose, leading to subsequent ulceration. In addition, the FiO2 is not guaranteed and is influenced by other patient factors such as anatomy and breathing patterns. So let's try that on our patient at the maximum flow rate of 6 liters per minute and see how he does. On reassessment, we can see that his hypoxia is not resolving. So this indicates that we now need to escalate to the next device. Looking at our strategy, the next device to try is the standard oxygen mask, and this is because it can provide higher levels of oxygen concentration, up to around 60%. Now, the standard oxygen mask operates also on the principle of increased flow, creating increased FiO2. When operating a mask, it is recommended that you use flow rates of no less than 6 liters per minute. However, it is not uncommon for some patients to find masks, of any kind for that matter, are uncomfortable for use. This is a common drawback of this device because patients who are breathless tend to feel a little claustrophobic when we have something sitting over their nose and mouth. But it is a great choice when prongs are not adequate. So let's try this next on our patient and see how he does. On reassessment, we can see that the saturations have come up a little, but the patient still remains hypoxic. We need to now escalate to the next level, which is the non-rebreather mask. Now, the non-rebreather mask can produce around up to 80% of FiO2. This makes it well suited to moderate and severe hypoxia. The key difference between the standard mask and the non-rebreather mask is the presence of two things. One is the reservoir bag attached to the end of the mask, and the other is the presence of one-way valve flaps in the mask and also at the opening of the bag. It is these features that allow it to produce an FiO2 of up to 80%. The drawback, however, is that it is slightly more complex to use correctly, and it also requires much higher flow rates of oxygen. 10 to 15 liters per minute is the recommended rates whenever you use a non-rebreather mask. Let's try this one now on our patient and see how he does. On reassessment, the saturations have continued to rise a little bit, but still the patient remains hypoxic. We need to now escalate to the next level, and this is now the CPAP device. The O2 CPAP system is a specific CPAP device designed for use with wall oxygen, or oxygen from a cylinder. It is comprised of a sealing mask with a special CPAP valve fitted. CPAP systems are different to any of the devices we have discussed so far because of the addition of positive airway pressure, which have many beneficial effects, all leading to better respiratory function. However, it also means there are certain drawbacks. For example, CPAP may be the least comfortable of the devices if not introduced appropriately to the patient. It may potentially require higher flows of oxygen and may not be suited to all patients. Let's try this one for our patient. And now on reassessment we can see this is exactly what the patient required, as saturations have come up. Heart rate has also come down. Let's summarize. There are 4 basic oxygen delivery devices that we can use: the nasal prong, the standard mask, the non-rebreather mask, and CPAP systems. These should be employed in an escalating manner based on their performance and the clinical situation. Let's move on now to another case. AJ is a 55-year-old woman admitted to the ED with an exacerbation of COAD. She has been smoking for 40 years. On examination, she is alert and in mild distress with an SpO2 of 84% in room air. What oxygen delivery device is best used for this clinical situation? The important consideration here is the need for a fixed level of inspired FiO2 in COAD. Only the VENTURI face mask out of all our devices so far is able to do this. Depending on the selected barrel, which is the colored device attached to the end of the mask, a fixed or set FiO2 level can be delivered to the patient. The different colored barrels is each able to deliver a different level of FiO2 selected based on the patient requirements. But like other masks, this device also has the drawback of patients feeling claustrophobic when it's being used, but it has the advantage of all the others of a guaranteed FiO2 level when used correctly, most suited in the situation of COAD patients. And this brings us to the end of this session. Thank you very much for your attention, and I hope you enjoy the rest of the program. If you have any questions, I can be contacted on that email address at the bottom of the page.